Chair, Mr. Alan Tompkins. I would like to call the meeting to order, 12:01, and we'll be looking for approval of the agenda for the Human Services meeting.
I'll make
So moved.
support.
Has been moved and supported. Any discussion? Seeing or hearing none, all in favor say aye.
Aye.
All opposed, the same. Right. Next item on the agenda is public comment. Public comment, anyone? I don't see any public out here. No public comment. Okay. Right. Next item on the agenda would be the January 13, 2020 minutes. We'll be looking for motion and support for approval of
So
the minutes.
moved.
It's been moved and supported. Any discussion? All in favor say aye.
Aye.
All opposed, the same. Next item on the agenda is appointments for Human Services Committee. At this time, we don't have any applications, but we do have several openings on the Sanitary Code Board of Appeals, as well as the MALPH Committee is also looking for an additional member, which has to be a Human Services Committee member. So we will keep those open until next month for anybody who knows someone interested. At this time, we will move to the next item, which is the Lifeways monthly report. And I'm not seeing anyone from Lifeway, so we can move to the medical care facility report. And she is not here either. All right, so Department on Aging Senior Millage Ballot Proposal Request.
Good afternoon. This month's request is to this committee and then the full board asking permission to move forward with a ballot proposal for senior millage. The current .25 mils senior millage is expiring, and so another millage will be needed in order to continue the services that are currently provided at the Department on Aging. And it's grant and general fund that are not able to keep up with the cost of providing services. And I just wanted to also go over the attachments that, as you'll see, there is a dip in the number of hours of services provided that in 2017. And there's a variety of reasons for that, but the couple that I've noted are the Medicaid waiver funding that we've received in the past for Meals on Wheels and home care assistance. That began to decline starting in 2017. And also in our providing lighthouse cleaning and bathing assistance, we're having a difficult time hiring qualified employees to provide that service. And it's not just Jackson County Department on Aging, it's an industry-wide concern throughout the state and even throughout the nation to have qualified people to go into people's homes and provide this personal service. So we're working on, getting those numbers back up. Program participants, this chart shows all of our participants, but someone may be counted more than once. Later on, there's an unduplicated chart, but this one, so if someone gets Meals on Wheels, they also have a home visit from a social worker. That's called case coordination and support. So they're in there twice, for example. Someone who does exercise classes and also has a congregate meal, they're counted in there twice. And again, the dip in services after 2016. I'll go to the last attachment in board docs. So then this chart shows the unduplicated count for in-home services and Meals on Wheels. This does not include congregate or senior centers. And then back, so before I move on to senior millage rates in other counties, any questions about the amount of services provided 2013 through 2019 at this point? Okay. So the chart about senior millage rates, this particular chart shows millage rates for counties of similar size to Jackson County. And then you also have a list of all counties in Michigan that have a senior millage and what rate is the senior millage in each of those counties. And in the staff report, I think I also mentioned that the average for the 70 counties, when you average all 70 counties that have a senior millage, it's 0.5974 mils, or around 0.6 mils. So going from a 0.25 to a 0.60 mil is my recommendation in order to have adequate funds for the next 10 years. So that is an increase on a home worth $100,000. That's a $17.50 increase a year from the current 0.25 mils. So the motion requested is placement of a 10-year 2020 to 2029 senior millage ballot proposal on either the August 4th or November 3rd, 2020 election ballot at the annual rate of 0.60 mil to maintain services for senior citizens in Jackson County. And this month, then, it would be getting the board's approval to move forward. And then if that is approved, then next month, the resolution for that ballot proposal would come before the board.
All right, questions?
The actual resolution to appear on the ballot will be presented to us when?
At the March committee meeting, the actual language in the resolution. Mm-hmm.
Any other questions? Okay, CNA. Okay, sorry, Darius.
All right, just a quick question. How long would this millage last?
The current millage was 8 years, and the proposal I'm making is 10 years.
10 years. Okay. Thank you. Nothing further, Mr. Chair.
I'm sorry, current one was how long?
8.
8.
Okay, if there are no further questions, we will be looking for a motion and support to move it to the full board.
Aye. Nay.
Right,
Thank you.
thank you. And next item on the agenda is the Health Department, Henry Ford Allegiance Health and Health Officer Agreement.
Hi, good afternoon. My name is Angela Aldrich. I'm filling in for Rashmi today. She's at a training, so. The first item that we had was the Health Officer Service Agreement. This would be the 7th amendment to that agreement, which originated in 2012. There are really no changes to the original agreement other than Henry Ford put in place to have automatic renewal each year. But the clause to be able to terminate that agreement remains the same. Do you want me to go over that? Okay.
Any questions?
I think, well, every year they bring it back for a,
Any other questions? Seeing or hearing none, we'd be looking to move this to the full board.
So moved.
It's been moved and supported. All in favor, say aye.
Aye.
All opposed, the same. All right, thank you very much.
Last year, we entered a contract with Relias, which is the learning management system that we're using for our health department staff. The amendment is that this would basically just change from our custom library that we purchased at last year. The company has changed so that we no longer are able to do a custom library, and instead we'll have the basic library, which is actually a much more extensive array of courses that we can offer our staff. It's at no additional cost, so it's really just a changing from that customized library to the basic library.
Right, any questions? Just one question, is this something that is approved here, is this gonna move to the full board? So we would be looking to approve this here. Is there any additional questions?
Support.
It's been moved and supported, all in favor say aye.
Aye.
All opposed the same? All right, Health Department, Laboratory Director Services.
So this would be the fourth time that would be approved for the laboratory director services. We are required to have a laboratory director to be able to do our CLIA covered testing in our sexual health clinic. This, again, is just a renewal of that contract, and once again, the only change is that it would become an automatic renewal, and the same termination clauses would apply. I did just want to note in reviewing this that in the financial section on the report, it mentions 8 to 16 hours per week. It's actually 8 to 6 hours per month that we utilize that service. Yeah, pretty much 8 is what we use her for.
Questions? Mr. Bear.
Did I understand you that this, what we're entering into today, will be an automatic renewal in the future?
Yes.
How will we control the costs if it's automatically renewed?
I believe they're set forth in the agreement with a specific amount. And once again, we could always exit out of that agreement at any point. I think we have to have a 30-day notice if we were going to find that that cost went up greater than we could cover.
Okay, in the actual agreement to be signed, I don't see a cost written in here. Am I missing it?
Under Article 3, 3.1 compensation, it says the health department would pay the hospital the amount of $31 per hour for each hour of laboratory director services provided.
What page or article is that fee on?
That is
Okay,
on
I think I found it here. Compensation, Article 3.
page 2 of the original agreement.
Okay, that covers it. Thank you.
You're welcome.
Just one question for clarification for Mike. I'm just curious on this action that's recommended to go to the full board. Is that because there's a cost associated with it over the previous item?
Well, let's look at that a second. No, the amount is less than $3,000 a year, roughly. Anything, if it's under 75, you can approve, but if it's multi-year, it usually goes to full board. And since it's self-renewing, that's probably why that's that way.
Okay, well, thank you for the clarification. So at this time, we'd be looking for a motion to move it to the full board for approval.
Support.
It has been moved and supported. All in favor, say aye. Aye. All opposed, the same. All right, thank you very much. And last on the list is Health Department February 2020 monthly report.
Okay, the first item that we wanted to share with you is about our maternal infant health program. On January 7th and 8th, we underwent a review process from the Michigan Department of Health and Human Services. This was the Cycle 7 review. We did have the reviewer on site for 2 days. She did things like do a staff interview, really get into our charting, documentation, billing, audited different areas. She had a lot of great praise for our team and the work that they do, especially in conjunction with mental health coordination of services, which is a large issue with our maternal infant health program. She also commented on how well the staff work with the early on program and getting that early childhood development screening right away with our infants that we see. We have not received our final report yet, but we did receive the preliminary report where we did receive one critical indicator, which is about ages and stages screening, so there's very specific timelines. So we'll be doing additional staff re-education on those areas. We also had several non-critical indicators that were not met. This report indicates that we were having a meeting with the director of the Division of Maternal Infant Health at the state. That meeting did take place, and we were able to discuss some of our concerns, get more feedback from the state level. They are changing the review process for next year, so they recognized some of those things that we were already talking about, and so they'll be moving to a new weighted system next year. But we're expecting that final review within the next month, and we do have a few areas that we shared more information, and some of those not met, so they will be taking back. So any questions on maternal infant health? Okay, and then we would like to spotlight one of our areas, program areas each month. So this month, Rashmi would like us to spotlight our sexual health clinic. This is one of the programs that I really enjoy working with. We really give a great array of services to our Jackson County residents. We do this in the most non-judgmental way possible, so that we have clients that are comfortable returning for our services each month. In addition to screening for sexually transmitted infections, we're also doing things like pregnancy testing, hepatitis C screening, HIV screening, and counseling, education, really a good variety of things that we're offering in our clinic. Just to give a good idea, our clinic is nurse-run. We work under the standing orders of our medical director, so we don't have a physician in the clinic, but our nurses are well-trained to follow those standing orders. In addition to just coming in and getting a sexually transmitted disease screening, we're really trying to offer a more comprehensive look at healthcare, focusing on the social determinants of health. So each of our clients, when they come in, they will get screened through the Jackson Care Hub assessment. That really looks at things like housing, abuse, food security, really a wide variety of issues, and then through that we're able to make really solid referrals and also get that referral back through a closed loop system, so we don't just make a referral, send the client out the door. We're really able to get some feedback. Were they able to get connected to care? Were there any barriers? That sort of thing. We're also doing immunization assessments at every visit, and our nurses are trained in both clinics, so they can provide immunizations at the time of that visit as well. Just kind of taking a glance at our STD rates. It continues to rise throughout the nation. Jackson County is no exception. We continue to work on this, but we are continuing to see increases. So looking at between 2016 and 2019, our gonorrhea rates have gone from 44 per 100,000 to 150. So really that's looking at a count of about 63 known cases of gonorrhea in 2016 and going up to 240 by 2019. Chlamydia rates, they've remained pretty much the same, but still a pretty high number at 559 per 100,000, or about 886 cases each year. CDC estimates that the healthcare costs associated with sexually transmitted infection is about $16 billion. So that's why it's so critical that we're trying to, find these cases and get treatment as soon as possible. Some of the challenges operationally that we face in the sexual health clinic are really related to financial limitations and subsequent staffing challenges. So the STD control and prevention is a mandated cost share service under the Essential Local Public Health Services. Even though that funding has remained pretty steady over the last several years, it only covers about 36% of our operation cost. And then going back to the idea that we're a nurse-run clinic, we're not able to bill for our services. So that's one of the limiting factors. If we had a physician or a mid-level provider that was doing the actual services, we could bill, but really looking at past times that we've tried to really narrow down on those costs, it wouldn't be a cost benefit. I mean, the number of clients that we see, it would cost us a lot more to have one of those providers on site. And then also clinic fees. We do have clinic fees, $11 per visit for in-county residents. That's often waived. I will say our clientele, we have clients of all levels of income, but we primarily see a lot of lower income clients. So to be charging a high fee would really hurt our efforts in the long run. Some of the strategies that we're doing, especially more recently, to combat the issue of STD spread is that we're offering extragenital screening. This helps to make sure that we're not missing cases of gonorrhea that would be found in other sites other than the one that we typically screen for. We're also offering expedited partner therapy. This is really huge in the last few years. This is basically treating, if somebody comes in and they're positive for chlamydia or gonorrhea, we're able to treat their partner without actually even seeing their partner. And that's a huge effort to really combat this, the spread of infection. We're also working very closely with our providers in the community to make sure that they understand under the public health code that they're able to do that as well. Our nurses, I think this is a little known fact that we're not just screening people that are coming in to the clinic. We're offering services out in the community. They also have a responsibility that any person that had a positive STD screen in the county, who live in the county, they're following up on that. So even if they went to their primary care physician, if they went to Planned Parenthood, wherever they're going, we're looking that up in MDSS. We're reaching out to that client, making sure they got the treatment that they needed, there were no barriers in getting it, that they actually took it correctly, and to see if their partner was treated or needed assistance in getting treatment. And then, of course, we're collaborating extensively with agencies in the community to help out wherever we can assist. So that's our clinic highlight. If you have any other questions, I'd be happy to let you know.
Mr. Kennedy.
You mentioned some people's fees were waived. And what's the threshold on that?
It's basically if they're unable to make that payment, we waive it.
So if you don't look at their income at all, it's just word of mouth?
Yes.
Okay.
Yes, if they're not. We also have several clients who maybe they come in and they have $5, then they'll give us the $5. We do make a note of that in their chart, so the next time they come in, we can say, last time you weren't able to pay this fee, are you able to this time? Are you able to pay for this visit and last time? So we definitely work with our clients because the cost of not treating them, if they're positive, is huge compared to that $11 fee, and we know that the effects on things like fertility issues, longer-term things that they might have to seek higher level medical care are very costly. You're welcome.
I just have just a couple of questions for you. I'm curious for, well, one, if we can have like a report of all STDs in comparison to 2018 to 2019 numbers. And I'm also curious on how our STD rates compare to the national rates and where we land in that perspective as well.
Absolutely, I can do that. Okay. Right, I can definitely put that together. Just one little thing I'll point out. So over the last 5 years, Jackson County, we've seen a 347% increase in gonorrhea cases. So that's pretty huge, just looking at the last 5 years. But I can definitely put it together.
Tracking with national?
Yes.
Everybody?
In the nation, yes, the numbers are, especially chlamydia, gonorrhea, and syphilis, those numbers are rising nationally.
So what has been done?
A lot of these efforts that were the expedited partner therapy, we're hoping that would have some positive effects. The extragenital screening, certainly. I know even here locally, our sexual health clinic staff has worked closely with our teen pregnancy prevention staff. They had a grant that we recently did a lot of work with teens. So sometimes that's a barrier. It's for teens to come to the clinic, for them to understand and feel comfortable. So they've been doing a lot and making commercials that can be seen on social media, and really kind of walking a teen through, literally, we have a teen walking through, coming in for services. How do they get condoms? How do they get services? Where do they walk through the health department? Those kind of things. It's hard to change behavior, and that's huge in this this issue.
Well, I appreciate it. I think sharing that information as much as possible is another deterrent. I know last year with that huge increase in gonorrhea and chlamydia, with just putting that information out to the community that it was so prevalent, was a huge help in at least educating the community on the situation.
I agree.
Any other questions? Okay, thank you very much.
Thank you.
Next item on the agenda is to approve the claims. It's been moved and supported. All in favor, say aye.
Aye.
All opposed, the same. And we have minutes on here from DHHS board meeting, as well as from the Veterans Affairs Committee. If you want to take a look at those, the March reporting schedule is Department on Aging, Health Department, Lifeways, DHHS quarterly. The Medical Care Facility quarterly meeting is what we can expect to see next month. And we are back to public comment. And we still have no public commissioner comments. Seeing or hearing none, we are adjourned.